Ready to go? Good afternoon, everyone, and thank you again for joining us for today's briefing. We will be joined, of course, by Dr. Morrison and as well Dr. Karen Phillips, who's an epidemiologist with CPHO, and they'll spend a significant amount of time talking about the updated modeling that we have in place for PEI and some of the factors that we're using to make and inform our decisions in this. I should just begin, I guess, by expressing the sympathies to those who have lost loved ones in the past number of days. It's always a difficult time when you hear that, and sometimes I think that we as islanders look at those as statistics as opposed to what they really are, and that is that families and individuals lost somebody who was important to them, and that is difficult. And regardless of their situations, those are individuals that, if anything like my own situation, that they weren't prepared to say goodbye when they did. But so to all of those who have lost someone, I offer my sincere sympathies. I've been thinking a lot about, I have all kinds of different notes and papers here, and just been trying to think of what is the best thing to say. Having been through almost 23 months of this together, it's hard to come up with things to say that Islanders haven't heard before. And I can only imagine many of you are tired of hearing some of the things that we have been saying, probably as tired as we are of having to say them. But I guess just to begin, COVID has been a really horrible thing. It's stolen so much from us. It's changed our lives. It's changed who we are as people. It's divided us as a province, and that's just such a horrible, horrible thing. And we're working our way through this last difficult leg, and this has been the most difficult time for us as Islanders. We've been able to avoid a lot of the dire effects and impacts of COVID, but in this last 5-week wave, it's hit us especially hard, and that's tiresome for you. It's difficult for all of us as Islanders, and it's just a really, really horrible, horrible thing that we've had to go through. And when I think of that, I think of all the things that are stolen from us, and I hate COVID for that reason. I also think that the 23 months have brought us together in many, many ways, and which is the approach we will need as we begin to make our quiet and cautious and careful steps out of this. The road we have to travel won't be easy, but we have to begin to make it, and we will announce some measures today that will get us on the path to where we need to go. It will be a difficult road. We're into a very choppy part of this. This is to state the obvious, that this is the hardest and most difficult time of COVID, and the next 10 to 14 days will be that. And we're trying our best in the leadership roles that Dr. Morrison and I have to cushion Prince Edward Island to the best extent we can from the worst impacts of this, but we're not able to do it in its entirety, and that's just the reality of COVID. But the measures that we implemented in December, and again, the additional measures we implemented in January, have helped. They have probably, by the modeling, have chopped the high part off of this wave, and has allowed us to remain relatively stable throughout this. That doesn't mean we haven't had challenges, and we certainly know that 9 island families have lost somebody in this, and that's not to diminish that in any way. But we also know, and we've also been prepared for the fact that we will need to make our steps back from this. And we're going to announce some of that today, and Dr. Morrison will share it in a moment. But we will be having in-person school beginning on the 31st. We will get our students back into school, and we know that's where they need to be. They've been out of school for well over a month, and that's brought its own challenges. Our teachers, our school administrators, our parents have been champions through this. Our kids have been champions through this, but it's time, and we need to get them back into school, and we will talk about that a little bit more today, and there will be a full briefing tomorrow with Dr. Morrison and some education officials on what that back to school will look like. And we will also begin to make our way back. As I said, it won't be without our challenges. We will see cases continue, and that's the reality of what we're living with today. And I would just say again to all Islanders, this is a difficult time, but we will get through it if we continue to stay together. We will get through this. We will work our way through this together, and there is an end coming to this for sure. So Dr. Morrison, I deviated from all of my notes, but maybe you can stick to yours and give us the most up-to-date COVID information, as well as some of the plans to get on the road to walk our way back to some kind of normalcy.
Thank you, Premier, and good afternoon. It is the hardest part for all of us at this point in the pandemic, and it's rough to have this hardest part 23 months into it. It feels like we're in for sort of a rough landing or a really tough road ashore as we get there. But I am optimistic that we will get there. And the Premier, you referenced that we're going to do this together the way we've done it through the last 23 months. And I am hopeful and I am optimistic. And it's really one of the first times I know that there is an end in sight. We've talked about it so many times, it's hard to have that certainty. But I really think that based on what we're seeing internationally, nationally, and even regionally, that we will be in a very different place as a province a few weeks from now than we are now, presently. So today, really, I'm just going to talk about the situation here in PEI, spend a few minutes on modeling, and then some of the recommendations effective January 31st. As of 8 o'clock this morning, there are 255 new cases of COVID-19 to report, bringing our total active cases to 2,640 and overall 6,800 since the pandemic began. Over the last 7 days, we've had an average of 242 cases per day. There are presently 14 people in hospital being treated for COVID-19, including 2 people in intensive care. In addition, there are 2 people in hospital who are positive and are being treated primarily for illnesses other than COVID-19. In terms of outbreaks, there are outbreaks in 7 long-term care facilities, including a new outbreak at South Shore Villa, as well as Atlantic Baptist Nursing Home, Garden Home, Clinton View Lodge, Somerset Manor, Andrews of Park West, and Beach Grove Home. There are outbreaks at 2 community care facilities, including Miscush Villa and Bevan Lodge. As of this morning, there are 17 early learning childcare centers with cases or outbreaks of COVID-19. 2 centers are open, 2 are closed, and 13 are open with modified or limited services. There are outbreaks in other congregate settings, including the population that accesses shelter and outreach services in Charlottetown, Prince County Correctional Center, Provincial Correctional Center, Provincial Addiction Treatment Facility, and St. Eleanor's House. In addition, we know there are outbreaks at numerous workplaces across the province. We reported our first deaths related to COVID-19 on January 14th. In total, 9 people have passed away related to COVID-19. And as the Premier mentioned, our sincere sympathy to the families and friends who are mourning the loss of their loved ones. And also, as the Premier mentioned, these are not statistics or cases. These are someone's mother, father, partner, husband, wife. And we share in that loss. We've received a number of questions regarding how it's determined if a person's death was related to COVID-19. In essence, if the attending physician believes that COVID-19 was the cause of death or a contributing factor, then it is classified as a COVID-19 related death. And this is the same criteria used for any other communicable disease or illness such as influenza, stroke, or cancer. It's important that we capture and record the cause of death accurately and consistently for the purpose of disease surveillance and monitoring. During the last week, we reported almost 2,000 new cases of COVID-19. The largest proportion of cases, 38%, occurred in individuals between the ages of 20 and 39 years of age, followed by 25% in individuals between the ages of 40 and 59. 238 cases, or 12%, were in children under the age of 12. Now I'm going to see if I can just switch over to show some slides regarding our indicators and modeling. And I don't know how that's going to work from a televised point of view, but I can see the screen, and so maybe I'll speak to it, and I'm not sure what the best option is. Okay. Okay.
Will be on the screen for those who are tuned in, Dr. Morrison.
Right, okay. So this is really to highlight some examples of the indicators we use to illustrate our current COVID-19 situation and to share updated model-based projections for COVID-19 outcomes under different scenarios. Recognizing, and that we've talked about this here before, that models are imperfect and just one of many tools used to inform our public health response. So we've spoken about it here previously, about what indicators we look at, and we've been following different indicators throughout the pandemic, but more recently we've really been focusing on some of these indicators, and there are daily cases, our hospitalizations, and our trends related to those hospitalizations, our test percent positivity, our test percent positivity at our point of entry, the percent of cases that are unlinked, our outbreaks, our vaccination rates, and also regularly looking at regional, national, and the international situation. So for over 2 years now, these indicators have been tracked, and their trends are used to inform our response. So in the next couple of slides, I'll share examples of some of these indicators that illustrate our situation and contribute to the implementation and timing of the circuit breaker. This is a chart of daily new COVID-19 cases, with the number of new cases per day shown by the orange bars and the 7-day average of new cases per day shown by the black line. As you can see, the number of new cases had been rapidly increasing since the end of December 2021. Now, and then in the last number of days, you can see a decreasing trend, certainly over that last week. For PEI, there is confidence in COVID-19 surveillance as COVID-19 testing capacity has been maintained by focusing testing clinics to those of highest risk to be infected. This is another example of one of the indicators. It's a chart of the daily COVID-19 tests with the number of tests per day shown by the orange bars and the 7-day average of percent positivity shown by the black line. Percent positivity is, as it sounds, the percentage of COVID-19 tests performed that are positive. Percent positivity had been increasing since mid-December, and signs of leveling off have been seen in recent days. Percent positivity was over 20% as of January 22nd. This was considered high and suggested high infection rates and widespread infection. It is now, over the last 7 days, the average is 18%. This is yet another example of a chart related to our COVID-19 hospitalizations, with the number of cases in hospitals shown by the blue bars and the 7-day average of cases in hospitals shown by the black line. As you can see, the number of hospitalizations have been increasing since the end of December 2021. And maintaining healthcare capacity is important for everyone in PEI. And of course, the impact of this trend on healthcare is concerning. But it also, we've said that hospitalizations tend to be a lagging indicator when you look at cases versus hospitalizations. This indicator is really about vaccine uptake, and indicators that really are positive trends in PEI have been related to the COVID-19 immunization. Being vaccinated is the single most effective measure for reducing the burden of illness related to COVID-19. Data from British Columbia, for instance, shows that being unvaccinated is the strongest risk factor for severe illness requiring hospitalization or critical care. As of Saturday, January 22nd, 96.3% of island residents aged 12 and over have received at least one dose of vaccine, and 93.1% are fully vaccinated. Among children aged 5 to 11, 64% have received at least one dose of vaccine, and this age group began getting their second doses last week. Getting your children aged 5 to 11 vaccinated will protect them from serious consequences related to COVID-19, including hospitalization and multisystem inflammatory syndrome. I urge parents and guardians to get their children vaccinated to protect them against COVID-19. Over 48,000 island residents have received their third dose of COVID-19, and getting your booster when eligible is highly effective at preventing severe outcomes related to COVID-19, including hospitalizations. Getting a booster improves our level of protection against COVID-19, and if you do get it, you will be much less likely to require hospital care. However, there are still 24,000 people who are eligible to get their boosters and have not yet done so, so please get your booster as soon as you are eligible. There are vaccine appointments available across the province for people to receive first, second, and booster doses, as well as for children aged 5 to 11. This is now not the time to be complacent about being vaccinated. It continues to be the time to roll up your sleeve and get immunized against COVID-19. Another tool used to inform public health response in PEI is modeling of COVID-19 spread and its impacts. Throughout the pandemic, modeling for Canada, PEI, and other jurisdictions has been informative for decision-making. While modeling is not a crystal ball that can predict what will happen, it can provide forecasts of what may happen under different scenarios. And the next two slides show model forecasts created using data from PEI nationally and internationally. These two charts show forecasts of daily new cases and hospitalizations if circuit breaker restrictions were not implemented on January 19th. The yellow curve on the left shows the 7-day average prediction of the number of new cases per day, and the pink curve shows the prediction of hospitalizations on the right. The red lines show real 7-day averages of new cases and hospitalizations in PEI. When interpreting model predictions, one should always compare to multi-day averages of real data. Without a circuit breaker, PEI was expected to average, and you can sort of see, it's hard to see all the numbers, but over 300 cases a day for a number of weeks. The number of hospitalizations was forecasted to continue increasing for the next 3 weeks. The prediction of daily new cases tracked real PEI data very well. Now, when modeling small populations such as COVID-19 hospitalizations and PI, random fluctuations around model predictions are expected. So the shape of the hospitalization forecast is informative, but the number of hospitalizations predicted always has to be done with some caution. Now, this slide, these two charts show forecasts of daily new cases and hospitalizations if circuit breaker restrictions started on January 19th successfully decreased contact rates. The yellow lines show forecasts if contact rates stayed the same, like the previous slide. The pink lines show forecasts if contact rates decreased by 10%. The next blue-ish line shows if contact rates decrease by 20%, and the orange lines show if contact rates decrease by 30%. The forecasts show if we collectively decreased our contact rates, the peak of this surge should be lower and be over more quickly for both new cases and hospitalizations. And that's what we've been wanting to do. It was encouraging that modeling indicated a circuit breaker had potential to effectively lower the forecast of new cases, depending on our adherence to the measures. It was also reassuring that this modeling for PEI supported evidence from other jurisdictions that contact rate reductions needed to blunt this surge were possible. As we have throughout the pandemic, by working together, we could reduce this surge and its impact on our island. We can also use these charts to try to estimate the impact of the circuit breaker had on our contact rates so far. The forecast for average daily cases without a circuit breaker was over 300 for today. And here, over the last 7 days, there have been an average of 242 new cases per day. So the model forecast that most closely predicted that average on this date was the purple or blue line, where contact rates decreased by 20% when circuit breaker restrictions began. And this is a positive sign that Islanders again responded to each other, changing our behavior and interactions over the last week to 10 days. It's important to point out that the shape of the forecast assumes contact rates are not relaxed following the start of the circuit breaker. However, when restrictions will be relaxed and new cases will likely increase again, but it's how well we've been able to suppress some of these numbers to make sure that we can manage that increased number of cases when we go forward. Surveillance is in place to detect such increases as quickly as possible, and changes can be made to address increases as necessary. So I'll leave that for now. I'm sure there'll be questions. That was almost more of a technical kind of briefing, but I know there have been questions about that. So last week, as we've talked about, additional measures were implemented in response to the concerning trends in a number of our key indicators, including our 7-day average of new cases, our increasing number of facility-based outbreaks, the number of cases attributed to community spread, and increasing hospitalizations and ICU admissions. The purpose of the current measures in place until January 31st was to limit contact between individuals and thereby limit spread of COVID-19. Based on the modeling, it's apparent that these measures were effective, and Islanders did decrease the amount of contact they had with other people. But these measures are not without impact on individuals, families, businesses, and organizations. Thank you to all Islanders for their continued support, cooperation, and understanding. As a first step towards easing out of this wave of COVID-19, I have made the following recommendations. And this would be effective on the 31st of January. And the first one, the Premier's already mentioned, that the Department of made the recommendation to the Department of Education and Lifelong Learning that all K-12 public and private schools can reopen to in-class learning on January 31st, as per the most recent back-to-school guidance, with enhanced measures, including masking, testing, and cohorting. In addition, in terms of the measures on January 31st, and I think we have to mention this, that we already had restrictive measures in place, that we had put more in place in December, and that they were really fairly restrictive until this last circuit breaker type measures. But it would be back to personal gatherings, household with a steady and consistent maximum 10 people. And individuals would be encouraged to continue to keep their circle of contacts as small as possible. Organized gatherings of one cohort of 50, provided there is physical distancing between people of different households, and this would apply to faith gatherings and wedding and funeral ceremonies. Wedding and funeral receptions would still not be permitted, but team practices and recreational activities can occur up to 20 consistent individuals. Day camps would be permitted in groups up to 20 people. Fitness facilities can open with up to 50% capacity and physical distancing. In-room dining can resume with up to 50% capacity with 6 feet of distance between tables and maximum table size of 10 people. And food premises and licensed establishments would continue to stop food and beverage service at 11 p.m. and close by midnight. People must be seated to eat or drink. Standing receptions where food and drink are served are not permitted. No dance floors or karaoke. Masks cannot be removed when seated at indoor events, even when there is physical distancing of 6 feet. Other businesses and organizations are permitted to serve the public with up to 50% capacity and physical distancing, and this includes retail, casinos, museums, and libraries. VaxPass program remains in place for discretionary events and activities. Visitation in long-term care is increased to 3 partners in care and 3 designated visitors. In homes where there are outbreaks, there are additional measures in place, and individuals entering the province will continue to isolate for 4 days with testing. We will continue to take a steady approach as we plan to ease out of this wave, and we have to be careful not to get too far ahead of ourselves, and we take it one step at a time. We will be monitoring indicators and COVID-19 activity in PI on a regular basis and making decisions regarding further easing of measures. Our top priority is for students and staff to return to in-class learning as safely as possible. It is important that we take every reasonable step to support the reopening of our K-12 public and private schools. There will be additional information shared publicly later this week, I guess it sounds like tomorrow, regarding what measures are in place and plans to deal with situations when there are cases of COVID-19 in school settings. We know that safety in schools does not mean they are COVID-free. As we are experiencing firsthand, we cannot stop Omicron. We can only slow it down and flatten the curve, and we have spoken about this really since the beginning of the pandemic. In addition to the population level measures, we have a personal responsibility to protect ourselves and others. We will all need to continue to do our part. This means we should get vaccinated, including a booster, wear a good quality mask properly, limit our circle of contacts and social activities, stay home from work and activities if we are sick, and get tested at a clinic if we have symptoms of COVID-19. And really, if we want to walk out of this with minimal impact, we all need to do all of these things really well. We are navigating through a very challenging period of this global pandemic. And I know staff working in healthcare are under great strain, so certainly our thanks and reaching out to your healthcare provider and taking that time to do so to offer your support is certainly appreciated. Despite the impact of Omicron on our health system and our daily lives, as I mentioned in the beginning, I am optimistic that once we get through the next few weeks, things will get better, and that by spring, our situation will be much improved. As we continue to chart our course through these choppy waters, we know we will get through this. Although I know the Premier and I think, wonder some days, but together by taking it one day at a time, one step at a time. And something we have said all through, let us continue to be patient and kind. So thank you.
Well, thank you very much, Dr. Morrison. That is certainly a lot for everyone to try to comprehend, in particular the modeling, and just, I hope, gives many at least a snapshot of insight into all of the factors that go into making these decisions that we have been making and have been making all along. So thank you for that. And I would also remind the media that Dr. Phillips, one of our epidemiologists, is on the line as well if you need more clarification on that. But let's turn it over to questions from our friends in the media, beginning with Alison Jenkins from The Guardian.
Yes, thank you very much. I have a question around people who have recovered from COVID. With so many people recovering from COVID, what happens if you have had COVID and have recovered from it and then are later named as a close contact?
So, Alison, that's a great question, and we've actually, I think, just clarified some of the language around that on the website as well. So, it probably wasn't there last week, but it should be there now. And for exactly that reason. So, if you've had a recent diagnosis and you've recovered from COVID, not, and we're putting some parameters of dates around it because the reinfection rate with Omicron is quite different than if you had a previous strain. So if you've been diagnosed more recently with COVID and have recovered, and you were named as a close contact, you would not have to isolate in the same way. So you wouldn't have that 4-day isolation period, assuming you're fully vaccinated. So that language is. It should be up there on the website now, but we were getting definitely questions about it with more people having had COVID and recovered.
Okay. Thank you. And can you explain the interval of time between the second dose and a booster shot for adults and the first dose and the second dose for children?
Okay, so the interval between the first and second doses for both adults and children, it's recommended to be a minimum of 8 weeks.
Okay.
And so that part is very similar. And they know that that's sort of based on what we know about basically the immune response that's stimulated with the interval for the vaccine. That's what we would want between the first 2 doses. And then the booster dose then is that 6 months later. At this point in time, there's no recommendation around booster doses for children or youth, but the National Advisory Committee on Immunization will continue to look at that evidence over time, but at this point, I think that's what you were possibly asking.
It is, yeah. There had been some questions as to, is it 2 months or is it 8 weeks? Which, if you do the math, it adds up kind of differently.
Okay.
If you just go date to date. So, but for the 6-month situation, does that mean that today, January 26th, that anyone who had their second dose on July 26th is now eligible to book a booster?
Absolutely. So we've said 6 months, but we've also said, and I think it's on the website too, really the important thing is getting vaccinated. So if you, if it's 5.5 months and you want to get, you've booked to have your vaccine and it's 5.5 months, absolutely. We want you to get it, and the Premier and I finally got in to get ours.
Excellent. I'm glad we didn't delay it too much. Yeah.
We canceled, had to rebook a number of times, but so that's really, it's to try to get in, and the same thing, whether it's 2 months or 8 weeks, and then you're there a few days early. Those certainly, we don't want to be turning people away, but we want to make sure that people are aware that interval is really important to provide the best protection long term.
Okay.
And that's really, we don't want to give a vaccine that's not going to provide the longer lasting, better protection.
Okay, great. And has there been much confusion about that? Is that perhaps why people aren't going for their boosters, is because they're wondering, is it 6 weeks, 6 months, or is it my time yet?
I know it's been talked about really since really after Christmas with Health PI and the booking clinics. I think they're trying to make sure that language is on the website around the 5.5 months. Even though we've said right along it's 6 months. I'm not sure that's it, or if people just are thinking, well, maybe I'll wait, or maybe I'll get COVID. But it's really important, even if you've had COVID, once you've recovered, to get vaccinated. Every week, every day, we are seeing evidence and the studies coming out from other places that really show the booster dose is going to protect you, and that's probably more important at this point in time than we knew a couple months ago.
Okay. I do have one more question, if I may. We were kind of wondering why the numbers weren't going down, but it looks like from the modeling they are going down a little bit. Wondering how much, are we going to continue to see that, even though we're changing some of the rules?
Well, I do think when we go back to school, we will likely see cases increase, and with all these modeling, we know that when we ease up measures, that the cases may go back up. And that has to do with more contacts, but by having reduced and suppressed some of those cases, we hope that we can also, from a capacity point of view, still manage that slight increase in cases. But that sort of speaks to what we're trying to, I think the Premier alluding to it as well, that it's really important that we wear masks when we're supposed to, that we keep our circle of contact small. So even though we're sort of stepping cautiously out of the circuit breaker, we're still have restrictions and public health measures in place for good reason, so that we can ease out of this slowly and not overwhelm the system and minimize how many people will get sick. Okay. But realizing it's a balance. This is always a balance going forward.
Great. So, thank you very much.
You're welcome.
Wilson, Julien, Radio Canada, bonjour.
Bonjour, good afternoon to you both. I'm going to ask my question in English, so I would like an answer in both language. Premier, you just said earlier, it was time to go back to school. It was time to reopen. So today, it's the time. Last week, you said to me, it was the time to put some new restrictions, and today, it's the time to reopen.
What we're announcing today is are taking the steps back beginning on Monday, the 31st, and not today. Have been asked by teachers and others to give as much advanced planning time as possible. So that's what we're doing. We put in place the latest measures because we wanted to take a 2-week interval, and we will do that. And based on some of the modeling, et cetera, that you've seen, there's a level of comfort wrapped in a lot of trepidation, of course, but there's a level of comfort from our health professionals to begin to, as Dr. Morrison has so eloquently said, to walk our way out of this. It's also important for everyone to remember that what we're taking our first step back to is quite a restrictive level of life. It's nowhere near what we would call normal. It's nowhere near what we hope to get to at some point, but it is that first journey back that starts with one step is to get back to there. So we will monitor this every day as we have throughout. We expect to see an increase in cases when we bring 20,000 students and teachers and staff back into a more normalized setting. As Dr. Morrison said, that's likely to, if there's COVID in the community, there will be COVID in the school, and I think we're prepared for that. But a couple of things that mean a lot to me in particular that Dr. Morrison has shared with me is that, you know, the high percentage of cases that we have are in a age group that tend to do better from a health perspective if they do, or if they are positive. That's a good thing. We have a very high vaccination rate of 3 doses with the over 60 age bracket, which tends to be the age group that has the worst, or could be impacted more negatively through that. So those are things that are important to us. But we know Omicron is here, COVID is here. It's not going away. We can't will it away. We can't stop it. We've slowed it. And we continue to try to take that approach to slowly walk our way out of this one step at a time. And the road forward is one we have to walk. And that's what we're doing, and that's what we're looking to on the 31st, those first cautious steps. But it's not; these aren't easy decisions to get to, as you know, and it's. I know very many different islanders have different viewpoints and positions on that, and we are taking the best information that we have and trying to share it and to make the decisions to go forward. And then that's where we stand today.
Bonjour, and maybe I'll just add in English, we do have 66% of those who are aged 60 years of age and older who do have their booster. Speaking to that number, that's something we're certainly monitoring, and over 80% of those 80 years of age and older have had their booster. The one, and I just, before I forget, one of the things I didn't mention was that some of the measures we've had in place, we really feel have been working to slow that incline that we saw on those graphs since December. The fact that we had the measures in place didn't make it as steep as it would have been if we didn't have those measures in place. And I think that's important to note. Alors, en français, on a pris 2 semaines sans école en classe, en personne. Et puis, et on sait qu'on commence à lundi, on va avoir plus de cas. Mais on a plusieurs mesures en place pour s'assurer qu'on a ça va être pas si grand nombre que ça. Alors, les tests, on a les cohortes, on a les masques à l'école. On fait tout ça pour essayer de continuer à l'école, d'avoir pas autant de nombre de personnes qui ont COVID avec étudiants et les personnes qui enseignent. Et puis, on va quand même mesurer chaque jour qu'est-ce qu'on voit. On sait que la meilleure place pour les enfants, c'est d'être en classe, en personne. C'est tous les études qui montrent que c'est en classe que les doit être. Même s'il y a quelques-unes de mes propres enfants qui ne vont pas, ils aimeraient rester chez nous. Mais ça, c'est pour les enfants, c'est meilleur. Alors, c'est avec... on ne sait pas exactement qu'est-ce qui va arriver, mais on sait dans quelques semaines, on va, j'espère, être à une place meilleure qu'aujourd'hui.
Est-ce que vous vous attendez à avoir une reprise des cas à la hausse avec ces réouvertures? Vous l'avez montré dans les graphiques, les cas sont à la baisse. Les hospitalisations sont quand même assez stables. Est-ce que ça vous donne une indication que finalement, lundi, on va réouvrir, mais les hospitalisations pourraient repartir à la hausse.
Oui, on sait que les personnes à l'hôpital, ça vient après le grand nombre de cas. Alors, mais on veut que l'hôpital ait la capacité de prendre soin des personnes avec COVID et aussi de prendre soin des personnes sans COVID. Alors, j'espère qu'on va avoir pas tellement de personnes à l'hôpital, mais le nombre qu'il y en a, on peut en prendre soin d'eux. Je pense que c'est entre comme les 2 semaines qui suivent qu'on va voir le plus grand nombre de personnes à l'hôpital, jusqu'à peut-être le 9 février.
Donc ça va être, selon vous, le 9 février, ça serait le pic des hospitalisations à l'île du Prince-Édouard.
C'est vraiment, on regarde crystal ball, mais ça dépend vraiment qu'est-ce qui arrive avec les cas. Mais à ce moment, ça montre ce qu'on voit, c'est le plus grand nombre entre le 2 et le 9 de février. Mais ça peut quand même changer chaque jour. Et chaque jour, on met les normes qui changent, qui peuvent changer.
My last question in English for you both. Do you really hope those restrictions we have in place right now, who's going to end on Monday, will be the last ones under COVID? I know you don't have a crystal ball,
Yeah,
but...
well, I'll answer that first. I sure hope they are. I sure hope that we can make our way back slowly, but safely, and to get there. I think that, you know, I can't imagine any Islander or any Canadian would say they are fans of lockdowns or these things, and I would add myself in that category. I mean, that's the last thing you really want to be having to implement. We've had to do it because for the reasons that we've shared for many months. But yeah, I really hope it is. But we have to let the science and the data guide us. All indications are that, you know, we as a country seem to be cresting when it comes to Omicron. But that doesn't mean it disappears. I mean, that doesn't mean it just vanishes. It's still here amongst us. And as Dr. Morrison has said time and again, that we need to continue to practice a lot of self-discipline, to be careful, to be mindful if you're going to school and we know you need to go see your grandmother or grandfather because it's important. But if those individuals are immunocompromised in some way, to be very careful with your interactions because they could be problematic down the road. So there's a certain amount of that all of us have to sort of take that on as well, to be careful and mindful. And I certainly hope there will come a time sooner rather than later that each individual will be able to make those decisions instead of government having to implement them on a broader scale. But yeah, I certainly hope that this is behind us. But you know, COVID has given and taken a lot from us over the last 23 months, and you have to be prepared for all aspects of that.
Alors, vraiment, juste en français, j'espère que c'est la dernière fois qu'on a assez de restrictions et puis on vraiment va commencer de voir les mesures qui sont chaque quelques semaines, vraiment. J'espère qu'on va marcher petit par petit pas hors de ces mesures. Alors, j'espère comme tout le monde. C'est la dernière fois.
Merci.
Merci, Julien. We'll go to our online questions from our friends in the media.
Brittany Spencer, CBC. Hello to you both. Thank you for taking our questions today. My first one is about with the plan for students to return to school on January 31st and the lifting of the restrictions in place right now. I'm just wondering what the modeling tells us about what that could do to the situation on PEI right now. I know that you both said that, we can expect to see more cases once students do go back to school, but I'm wondering what that modeling says in terms of how many cases and what that will look like.
Maybe I'll start, and then Dr. Phillips, if you're on the phone, you can add in. I think, hi, Brittany. We're going to be looking actually at ongoing modeling, not only for what it could look like after the 31st, but also at different stages of easing up of measures over the next weeks ahead. So it won't be just on the 31st. Of course, it's the modeling we keep saying is just one tool, and it's like trying to forecast a storm, a winter storm coming too far out ahead of us. It's really hard, and you really won't know until you're closer to the time what it's going to look like. So, but we are doing some certainly consideration of that modeling. Dr. Phillips, do you want to add to that?
Hello, thank you. I echo what you just said, Dr. Morrison, that as we move forward, it'll be an important combination of what we've used already, of looking at our indicators and our trends of our indicators, and various scenarios from the modeling. And as we gain more information of how our next few days and weeks go ahead, we'll be able to make adjustments and changes based on all that evidence.
Okay, and I'm just wondering if you could clarify or explain, with indicators like daily case counts still in the hundreds, there being a consistent number of people in hospital over the last couple of weeks, why now is the right time to ease restrictions and have in-person learning resume in schools?
Well, I guess I'll start, Brittany. A couple of things. One, we know that being in school, in-class learning, is very, very important for the well-being of students. And there are more studies coming out indicating the impacts of not having in-class learning. And so I think we are cognizant of that, and it's really important to recognize that evidence. We don't look at one day, and I think that's what we've tried to talk about. Indicators are not based on just one day. They're looking at trends. So we've seen what the trend has been in terms of cases over the last week. We also and I think trends over time, the more time, the better, but certainly indication of that trend going down is really good. I think we've tried to make sure that we eventually are going to move away from as much focus on cases, but more on severe outcomes like hospitalizations. And we've talked about that here before. And we know that hospitalizations are a lagging indicator, so they will often lag 1 or 2 weeks behind an increased number of cases. So I guess just a couple of those kind of comments. There's not necessarily any perfect time to do any of these measures, but we also need to recognize, and the Premier spoke of our vaccination rates of our children, our booster rates of those who are the most vulnerable in our community and most likely to end up in a hospital. We have other testing measures, masking measures, cohorting measures in place to go back to school. So no one's going to be going back to school without those kind of measures in place. And it's the multitude of layers of protection that we try to put together as we balance the impacts of all these measures. Dr. Phillips, did you want to add anything?
Hello, thank you. I support again what you just said, that it is the layering of all of these measures that helps to keep us as safe as we can. And we will have to keep an eye on the data going forward to see how we are handling this as far as cases and our more severe outcomes.
Absolutely, yeah.
Okay, thank you. And with that in mind, I'm curious about when students do return to school. You've said multiple times that we can expect to see cases of COVID-19 within our schools, and I'm just wondering how that's going to be tracked and reported, and whether that information will be provided to parents or made public. I'm just sort of wondering how that's going to work.
So, Brittany, I think the school system will be having we didn't want to get into too much. This seems like a lot on one day already, but I think we'll be having a separate press, and I'll certainly be involved with that. But we are going to do things a little bit differently than some of the other provinces in that we will be continuing to do case and contact management at the schools, just like we are in our community, and that reporting will occur in terms of the number of schools that are impacted with cases and multiple cases. So we'll maybe speak more in detail about that at the education-focused back-to-school press conference.
Okay, thank you very much.
You're welcome.
Thank you, Brittany.
Louise Martin, CBC. Hi, good afternoon. So I'm just wondering about the tragic deaths that we've seen over the last under 2 weeks. 9 people have died on Prince Edward Island related to COVID-19. But to really understand the impact on the healthcare system, will you be releasing where those deaths are occurring? Are they ICU patients, or were they ICU patients? Were they in hospital? Were they in long-term care homes? Will you be releasing that kind of information to sort of gauge the impact on people and on the healthcare system?
Hi, Louise. So a couple of things. One, the things we'll be also releasing, and that we are tracking our length of stay of hospitalizations, which does also impact the capacity. So I think we'll be talking about that. We will be doing summaries of outbreaks in long-term care in terms of number of residents and staff, and hospitalizations and deaths associated with outbreaks. We can't do it every day, as you can imagine. There's a lot of information to pull together, and I think there are a lot of different scenarios in terms of when people are in hospital, moving from ICU to medical unit to ICU. Sometimes people recovering while they're still in ICU, but their period of time that they're infectious for COVID is finished. We'll certainly continue to release as much as possible, but we're also very conscious, and I think try to respect that what we said, that these are individuals that are people's mother, father, husband, wife, partner, and we are not trying to release too many details surrounding a death that for privacy concerns, but certainly recognizing that we're tracking lots of information that really will impact the health system, and that's really about how many hospitalizations, lengths of stay, how many in ICU, and new admissions per day. So we're trying to make sure that we have that, but not maybe in all the detail that you've been asking for, Louise.
Yeah, so does that mean in terms of, for instance, there are 14 hospitalizations today, it would be useful, I think, to know how many are new versus how many are still in there, how many new admissions to ICU? Would that be something that could be broken down?
Well, we've said, there are, we can certainly look at that. We know that there were 4 new admissions in the last 24 hours.
Okay, thank you very much for that.
Yeah.
I'm wondering about how effective the measures like isolation mandates and testing at the border. Where are you seeing patterns of transmission? Last time I think you said, was it 30% were not related to travel? So why do we need, if we have widespread community transmission, what good is having a 4-day isolation period when in fact PEI has the highest caseload per capita now in the country?
Well, a couple comments. One, we are doing testing because we're able to still do that here in a way that's other provinces have exceeded their capacity to do the testing. So it's really important. It's good that we're able to measure what's happening here in a different way with our testing. The second thing is, we've had a number of weeks since Christmas, since the New Year, where we would have, over 250 cases of COVID identified at our points of entry, and that number means that those people are identified very quickly at points of entry. They aren't infecting others. And with Omicron, you can certainly infect a number of other people, on average, quite a few. So we will have, by picking 250 cases up in a week at points of entry, certainly if each one of them was to infect 4 other people, that's a lot of extra cases within 1 week in the province. So we are monitoring our testing positivity rate at our point of entry, which has increased since Christmas. So that's why it's still important to do, and how important that isolation period is, because that's not including how many people actually test positive after their 4 days in isolation. Now, having said that, one of the things that we will be looking at easing as well in the weeks ahead would be to remove the isolation and just have that testing measure in place. But that will be one more thing that we will hope to do in the weeks ahead. But we are still tracking how much is travel related and how much is in the community and close contacts.
Okay, and I'll just ask this again. I know you've been asked, and I'm trying to understand it in the most simplest of forms as just a layperson in the community. When people see the numbers coming through, Dr. Morrison, they see more hospitalizations, 9 deaths in less than 2 weeks, still case numbers in the hundreds. So can you explain in the simplest way possible why now is the right time to send students back to school in person, and why it is the right time, January 31st, to reduce some of the measures that have been put in place over the past couple of weeks?
Louise, I feel like I'm glad you asked me again, because if it's not clear, I have been trying to answer it. So there's no right time. But we know that the best place for children and students to be is in class learning. There are more studies all the time that show the impacts of not being in class. And we have to balance what we know is certainly best for the students as well as their health. So we're trying to look at all that information. We talked about the decreasing trend in cases, the leveling off of percent positivity. Since the enhanced measures were put in place. We know that the measures we put in place in December were making a difference as well in terms of limiting how many and how fast Omicron was spreading here. And we know that the other measures that we're going to have in place in the school and in the community and our personal public health measures will be really key, not just on Monday, the 31st, but in the weeks ahead. So if things change, we always will adjust, and we have all the way through. And I think we have layers of protection. We are trying to walk our way out of this 4th wave. And of course, the hospitalizations are of grave concern. As you say, the loss of any life in this province related to COVID is not what we wanted to see, and it impacts us all. We've had really the lowest. We were the only province in the country that did not have a death related to COVID for 22 months, and would still have one of the lowest death rates per capita related to COVID in the country. But do we know for sure it's the right time? It's hard to know, but we are really I think New Brunswick and PEI would probably be the last couple of provinces to have our students go back to in-class learning on Monday. And recognizing that we are having more measures in place when they go back to school with our testing, our masking, our cohorting, and everyone sort of following other strict in the community measures that really are fairly restrictive. I don't know if you want to add anything, Premier.
So the only thing I would say is there's 159,998 people who will be able to look back in a week and say, we should have did this, or we shouldn't have did that, or I would have did this, and I would have done that. And I guess we're the only two who don't get to do that. So we're trying to get the best information and share it, and to carefully walk our way back through the most difficult time of COVID. And that's where we're at today.
Thank you for that. Thank you to you both.
Thank you, Louise.
Terry Campbell, CBC.
I just want to pick up on the school thing just quickly and then ask a question or two about long COVID, if I could. I mean, this is just from a kind of a personal point of view, but I know there's going to be a lot of families that are kind of wrestling with the same issues. So we have a child under 12. We're trying to get him vaccinated as quickly as we can. He's got one dose. His second appointment is the middle of next week. Then I guess it's 2 weeks for that to kick in. Now, in his case, he has asthma. So I know he really wants to be back in school. I would love for him to be there, but as a family, we're going to have to discuss, what we think the risks are. There are cases or outbreaks in 17 different daycares right now. I'm sure it's going to be going through the schools. Forget about the asthma specifically, but I just wonder what advice you have for families if maybe they have people at home that are immunocompromised or anything. What advice do you have if they're, wrestling with what to do about a return to school?
I can start maybe there. Sure, and hi, Carrie. I think those are really hard decisions for parents. And there'll be all sorts of different scenarios in place. And I know some of the parents who were participating in the respite program last week or in the early learning sector had some of those same concerns. And I think it is around trying to remember about all the different layers of protection that we have in there. And we will have more cases, but we will be trying to do everything we can to limit that, the spread. But I do think some of the what they've been following in some of the other provinces, especially as schools reopen, are attendance levels, because I think some parents will choose to possibly keep their children at home, or at least for a while. And so they'll be looking at those absenteeism levels as they go in. And so I don't, I think it's just what I'd say to parents, Carrie, is that it's really hard, and I understand. And that we are not going to have zero risk for anything when we go back into a school setting for any communicable disease or any other risk that happens when they're at school. And I think it's really hard as a parent to make those decisions. The vaccination rates of each school will be posted for online, and I know the public school system and the Commission Scolaire Langue Française is also going to be posting those. Trying to give parents as much information as they can. I know that this is some of what we'll be talking about in what will be the next press conference will be around making sure that information, they'll be speaking to how important that information is to have on the website. That, for instance, if there is someone in a class or a cohort that has COVID, there will be a letter sent home to all the parents of students in that cohort and or class, and they'll be advised that there was a case of COVID in the class, that they monitor for symptoms, and there'll be increased testing involved. For take-home tests, antigen tests in that setting, and that close contacts in PI will still be, they'll do their best to identify those and be followed up differently than those just maybe in the class who aren't considered close contacts.
Okay, and if I could just ask a little bit, I'm just looking into long COVID projections, and Ontario had been projecting that 10 to 14% of their COVID cases would end up with, they'd be long haulers. They would have symptoms 12 weeks later, maybe up to 12 months or more later. I know I talked to someone who's been dealing with it for 2 years. Have we tracked this at all in PEI? Do you know how common this is here at this point, what you're seeing in that regard?
So Carrie, it's interesting. I briefly was mentioning long COVID just before we came down, and so, I mean, we are not really our cases of COVID. The majority of our cases of COVID have happened more recently, so we're not really into a period of looking at large numbers of people with long COVID at this stage. But I do think it will be really important to monitor some of those. We had, and I think I spoke about it previously. I see Elsa nodding her head about a study we had done in terms of follow-up with a number of our COVID positive cases. This was earlier on in the pandemic, and we were asking them questions about ongoing symptoms. And but again, those numbers were very small. So it will be important, and it'll also be important for our physicians and nurse practitioners to learn more about that in terms of the treatment and recognizing long COVID. So I think that is something that we'll be really having to enhance our surveillance on as we go forward. But we're really, at this point in time, mainly dealing with the response to this fourth wave, but recognizing that's an important thing for consideration.
All right, thank you.
You're welcome.
Gary.
Sue Neebe, The Guardian.
Hi, good afternoon, everyone. I guess it's the next question for Ms. Phillips and perhaps Dr. Morrison. Just hoping you could kind of clarify, you sort of indicated that the modeling seems to indicate that the existing circuit breaker has been effective.
Yeah.
I'm just wondering what indicator shows that. I mean, it sort of seems to look like the 7-day average of cases hasn't quite bottomed out. I mean, test positivity does seem to have, the rate of deaths is again, sort of the highest in the country. So can you take me through what indicators exactly say that the circuit breaker is working at this point?
So I'll start, and then Dr. Phillips can respond too. So, Stu, I think you're talking about indicators and models sort of at the same time. So in terms of what we have looked at are, is there a leveling off or a decrease related to the circuit breaker because of a decrease in contact rates, and that's based on those different percentages we talked about. And it's certainly indications would look like when we started on January 19th that we've successfully decreased those contact rates. So, and that way we've minimized the peak of where we would have been on today if we hadn't done that circuit breaker. So today there would have been, well over 300 cases if we hadn't had the circuit breaker, and certainly we're at less than that, and what we would indicate here. And again, it's not per day; it's by an average number for over a week. And again, and also the percent positivity is an indicator. You don't model the percent positivity, but we look at that as an indicator. And so models being, having their limitation, and the indicators we follow. Now, we also know this is Wednesday. Our circuit breaker is not over until the 31st, but we will be very gently easing up to fairly restrictive measures even on Monday. So the circuit breaker was never intended to stop Omicron. And that's why circuit breaker, when we use it this time, is very different than what we've used it previously. It's really to try to suppress the cases and make sure that our health system is able to manage the capacity that in terms of the cases, but also the subsequent hospitalizations, and to suppress that so we can open up a little bit more. So Dr. Phillips, would you like to add to Stu's question?
Hello, thank you for the chance to answer. And so I agree and support what Dr. Morrison just said, that it is a combination of the modeling forecasts and the trends of the indicators that would suggest that the circuit breaker has had a difference. And so if you look at over the last 7 days, there has been an average of 242 new cases per day. And for the modeling forecast, if the circuit breaker wasn't implemented on January 19th, the forecast was to have well over 300 cases for that 7-day average as of today. So that's a fairly big difference. Yep. For the trends for the indicators that Dr. Morrison shared in the presentation today, and that's daily new cases and percent positivity and hospitalizations, each of those over the last week have leveled off in their trend or even started to show signs of decreasing. And if the trend had continued as it was prior to the circuit breaker on January 19th, we would have expected those to continue to increase instead of leveling off.
Thank you, Dr. Phillips. And the one thing I'll add is that it also has given that much more time in the last week to have increase our percentage of people who have had their third dose booster, as well as having well over 50%, now 64% of those aged 5 to 11 with 1 dose of vaccine.
Okay, thank you both. So I guess my next question is about the long-term care outbreak situation. Over the last week, I've talked to a number of partners in care. Pretty much all of them have told me that they would like to hear specific numbers regarding the outbreak per facility. Several have also said they would also like the information of deaths associated with specific outbreaks. And I guess the reason is so that they can kind of know what's happening around their loved ones who are still in care. Some have found that the specific homes are providing information. Others are a little bit less consistent, and some have even said, go and talk to the CPHO to find out these numbers. So I guess I'm sort of wondering why, if it is sort of a bit of a public health issue, if people can't necessarily assess the risk around their relatives, that this information cannot be provided on a daily basis by the CPHO.
Stu, I indicated earlier on that was certainly pulling together the numbers of residents and outcomes in each of these outbreaks was absolutely something that we're trying to track and we will report on. If you had a chance to spend a day with us in our office, it's just not that easy. It sounds really easy to pull all those numbers together, But we have we aren't a big team, and we are doing an awful lot of work trying to manage these outbreaks and communicate with these facilities multiple times a day, and amongst a number of other parts of the response. So it is all important, and but we don't want to be giving inaccurate numbers, and they're changing on an hourly basis. So we will absolutely do that. We've said we would, and we'll do that the best we can. And I'm glad certainly the facilities can speak to some of that impact themselves, but we are happy to help pull that together, and we will do so. Again, it's really important that we give accurate information, and it's just challenging when we have so many numbers and so many outbreaks at the same time.
Okay, thank you. I guess my next question is, I'll direct at both Dr. Morrison and Premier King. I mean, there was a Health PEI clinical operational plan from October 2020. Now, it did state that in the event of outbreaks, there would be a long-term care mobile rapid response outbreak team. This would sort of be deployed into private nursing homes, I guess, and public, that would sort of help with contact tracing, quarantining individuals. So I'm wondering if this long-term care outbreak mobile response team was actually deployed during the recent outbreaks, and if they did actually ensure that positive residents were cohorted and quarantined, I guess, away from residents who had not yet tested positive.
Well, Stu, I think some of that maybe we can get Health PI to respond to as well. But I will say this, that there have been, so EMS, for instance, has gone in and helped do the testing of different cohorts and wings involved in outbreaks. And they do so really basically after there's one case identified, even before there are any other residents identified. They are given direction about staffing. There's immediate communication with infection prevention control, whether there's it's through the Health PI facilities, public facilities, or private facilities, through our office as well. They've had people go to the homes to make sure that there's compliance with some of the infection prevention and control measures. There's a great deal of back and forth and support for each of these outbreak facilities in terms of guidance. But what we've also learned about COVID is probably different than earlier on in 2020 in terms of what the best approach is to manage cases and close contacts. So the staff at the private and public long-term care facilities certainly, and their administrators, their directors of nursing, they're all working to try to keep their residents safe. And they have guidance, and they've had updated guidance and direction before Christmas, after Christmas, on everything from staff testing to masking and eye protection, and then every case at a long-term care facility, they look at who the roommates. Do they have roommates? How many people on the wing? How many people in the cohort? All those things. That's part of the how we manage cases and outbreaks. So I don't know. I don't know if there's anything else for me to add there. And Premier, I don't know.
No, that's just our response to all of this has been an all hands on deck response. You've seen people step up at an incredible rate, and it's all to try to keep as many people in PEI as safe as we can and deal with the outbreaks as they come. But I can probably get someone from Health PEI to answer the direct nature of the question in terms of what rolled out or didn't.
Okay, fair enough. Last thing, I mean, again, some partners in care I've talked to have reported that long-term care facilities are essentially barring access of partners in care. And there is a January 14th order from the Public Health Office that does pretty clearly state that partners in care should be given access, even in cases of outbreak, if they're following all the proper public health guidelines. So I guess I'll just sort of ask the question. I mean, should long-term care facilities that are in outbreak be allowing partners in care access, one of them, to their loved ones if they follow the public health guidelines?
So that, Stu, is exactly our direction. And certainly what people have learned from the first March of 2020 and long-term care, the importance of partners in care in these facilities. So that we've said 3 partners in care and for areas that are for facilities that do not have an outbreak, and 1 partner in care if the facility is in an outbreak. And also and so that has been our direction. We think it's important, but we understand that that may have been challenging for some of the facilities, but that is certainly our recommendation. And that's certainly part of the order as well.
Okay, thank you very much.
Thank you. I believe that brings an end, Dr. Morrison, to our, again, rather lengthy briefing. I want to thank you and, of course, Dr. Phillips as well, and all the staff at CPHO for their continued hard work, and to Islanders, just continue to work together and to get through this difficult time. So thank you very much.